Hello everybody. Today we're going to play a little true or false game. And the topic, Fluoroquinolones 101. Please watch this video. It could literally save your life. 1. Fluoroquinolones are a family of broad-spectrum systemic drugs, antibiotics, approved for the treatment of certain bacterial infections. In 2022, there were 14.8 million fluoroquinolone prescriptions dispensed in the United States. True. Two. Fluoroquinolone antibiotics have the strongest warning possible, a black box warning. In 2016, the FDA approved changes to the labels of fluoroquinolone antibacterial drugs, stating that these medicines are associated with disabling and potentially permanent side effects of the muscles, tendons, joints, nerves, and central nervous system that can occur together in the same patient. Additionally, we have determined that fluoroquinolones should be reserved for use in patients who have no other treatment options because the risk of these serious side effects generally outweigh the benefit in these patients. True. Fluoroquinolones only cause Achilles heel tendonitis. False. In 2008, the first black box warning label for fluoroquinolones mentioned Achilles heel tendonitis and tendon ruptures. In 2013, the FDA extended that warning to potentially permanent peripheral neuropathy. In 2015, the FDA held the special committee meeting to discuss the side effects of fluoroquinolones. This is when they identified and named fluoroquinolone-associated disability, FQAD, due to the severe and disabling side effects. This is also when the FDA stated that fluoroquinolone should be used as last resort. In 2016, that was the big update. That was the update that said fluoroquinolones can cause potentially permanent and disabling side effects and should be used when no other treatment options are available. Cipro is the only fluoroquinolone antibiotic I can take for XYZ condition. True. However, most of the time, there is an adequate substitute and you don't actually need to take a fluoroquinolone, but there are specific conditions and infections in certain individual circumstances where fluoroquinolone is the only option. So just remember, if you're unsure, ask. And even after you ask, double check, just to be sure, because doctors are just not reliable in this area. I've taken a fluoroquinolone so many times and have never had any issues, so I don't need to worry. False. Adverse effects can occur after your first pill or your 100th. Toxicity is a cumulative effect. It's like playing Russian roulette with your life. 6. Elimination half-life for fluoroquinolones vary from 1.5 to 16 hours. And after the antibiotic is stopped, if you did not experience any adverse effects, you are safe. False. Adverse effects can occur hours after just taking one pill to months after taking a fluoroquinolone, and harmed individuals may need to seek medical treatment not just when they initially take the antibiotic, but possibly months later. The FDA states, and at the time we received the reports, the side effects had continued for an average of 14 months to as long as 9 years after stopping the medicines. Several cases reported some side effects stopped or improved after discontinuation of the medicine, while others reported the side effects worsened or continued.